Welcome. My name is Dr. Eyyyyyy. How are you feeling today? Okay. Well, I hope we can make you feel even just the littlest bit better after you leave the office. Okay? Excellent. So let me see here. Would you mind just confirming your name and date of birth for me? Excellent. Alright, I'm just going to run through today what you called us in for. Alright, so it looks like we're doing a general checkup, although you've been noticing a lot of tiredness, a lot of eye strain, just general fatigue. Okay. Now, would you mind just telling me about that, about what's brought you in today? I may just take notes as you're talking, that I can get a good first-hand account from you about what's going on. Okay. Alright, so approximately when did these symptoms start? Do you recall? And on a scale from 1 to 10, how painful or uncomfortable, how much is this impacting your life? With 1 being not at all, not painful, not uncomfortable, and 10 being the most severe impact on quality of life. Okay, so rather annoying, right? Excellent. Alright. And have you noticed if anything at all has helped any of your symptoms? Any medicine, any sort of treatment at all? Okay, just mostly rest. Right. And have you had any major stressors or changes in your life recently, within, say, the last 3 months or so? Have you moved? Has there been any life transitioning? Anything going on? Okay. Alright, well, that gives us a start on that. So I'm just going to really quickly run through your history and make sure we check all of those little boxes. So, besides what we've just discussed, has there been any changes to your recent medical history at all? Excellent. And what about your family history? Any changes there? And your allergies? Any changes? And what about your medication list? Okay, still the same. Excellent. So, let me just set this down. So, with the tiredness and the general fatigue, weakness, all that can be a symptom of so many different things. And I think we're just going to start out with giving you a full examination, head to toe, just making sure that there isn't anything wrong right off the bat that we can see that might give us a better clue about what's going on, alright? So, I'm not going to use any gloves for this examination, right? And I would like to ask your consent to touch you. Is that okay? Excellent, great. So I just want to start out. I'm just going to take a very general look at you, right? I may ask you different questions from time to time just to hopefully help pinpoint anything that might be going on, right? At any point anything is painful or uncomfortable, please let me know, right? Okay, so just going to start off by taking a nice look at you. Just noting anything off the bat that might be out of the ordinary. Just noting and see if there's any symptoms, any signs of any pain or discomfort. Right. Now I'm just going to be feeling around your head. I'm just going to be assessing if there's any lumps or bumps, anything that shouldn't be there, alright? So you'll just feel my fingers just palpating the contours and ridges of your skull, right? Okay, so I'm just going to come in here and just take a little feel. I might get a touch closer. There we are. So, would you say that you have a pretty varied diet, or what's your diet like generally? Sometimes the first cause of tiredness or just a general feeling is sometimes linked to our diet. Okay. Excellent. And what about your sleeping? How would you say that your quality of sleep has been as of late? Okay, not great. What time approximately do you go to sleep, and what time do you generally wake up? Alright, now I'm just going to be feeling around your lymph nodes while I'm here. I'll be feeling the back of your head, underneath your chin, your neck, along your clavicle, right? So do you have trouble falling asleep, staying asleep? Do you sometimes sleep too much? Okay. Just feeling the lymph nodes here in the neck and down onto the clavicle here. Alright. And do you generally exercise? Okay. I take just a couple notes down while I ask you some more questions. Okay, and what does your screen time look on a day-to-day? How much are you on your phone, your computer, watching television? Okay. And are you frequently very close to your devices or quite a bit of ways? Okay. Alright, now I'm going to take a little feel along your face and your ears. I'm just going to feel all around, right? Just going to start here at your forehead, to the temples, to jaw. Do you mind just clenching your jaw for me here? Okay. Can you open and close your mouth then? Okay. Very good. Thank you. Any pain or tenderness in that? Okay. A bit? Right. Just going to come and just feel chin here. I'm going to tap on your sinuses here. Firstly, I'm going to tap on the frontal sinuses and then your maxillary sinuses, right? Please let me know if there's any pain or discomfort. Okay, not really. That's good. I know sinus pain is one of the most annoying things in the world, huh? Yeah. Okay. Any troubles with any of your senses at all? Your sight, your smell, your taste, your hearing? Okay, just a little bit of fuzziness with your eyes. Okay. Well, your eyebrows look very nice and full, very intact, as well as your eyelashes here. I'm just going to pull down on your eyes. I want you to look upwards for me. Look up. Very good. And now I'm going to pull upwards. I want you to look down. Okay. And your eyes are just a touch red, just a touch bloodshot, which lines up with how tired you said that you've been. Alright, well, let's go ahead and do a couple of eye tests real quick. So I have a little pen light here, and I'm going to be using this to conduct a couple of tests on your eyes, right? So firstly, I'm going to do the direct consensual pupillary response test, right? So I'm going to hold my hand up in between your eyes. I will bring my light and shine it in one eye, and the eye that I'm shining that light in should react to the pen light. And that would be our direct response. It's directly responding to the light being shined into it. And on that same coin there, same side of the coin, I will be bringing our light in and watching the opposite eye. Your opposite eye should react in the same way that your eye that I'm shining the light into reacts as well. That would be your consensual response, as your eye is consensually responding to the light. Right? So, put my hand up between us here, and I'm just going to look for the direct response, and then the consensual response. Excellent. Do that again, but with the other side. Direct, consensual. Excellent. Now I'm going to do the swinging light test, which just means that I will be swinging the light back and forth between one eye and the other. Just check for any defects. Just going to shine the light and then there. Just swinging the light back and forth. I'm going to have you do a test called Follow the Light, alright? This will be testing your ocular movements, and I'm going to have you watch my pen light, and I will just be moving it around, and I want you to follow the light using only your eyes without moving your head, right? Excellent. So, I'm just going to turn on the light. I want you to follow the light using only your eyes without moving your head. Just follow the light. Follow the light using only your eyes without moving your head. Follow the light. You're doing excellently. Switch it up a titch. Let's go up and down. How about to the right? My right. And to my left. Up, down, to the side, to the other side. Let's go diagonally up, diagonally down, diagonally down, and diagonally up. Diagonally up, diagonally down, diagonally down, and diagonally up. I want to check your accommodation reflex real quick. So I'm going to shine the light in your eyes again. I want you to follow this light as I move it in and out. And just keep following the light using only your eyes without moving your head. We'll go in and out. And in and out. And in and out. Switch to the other side. In and out. In and out. Excellent. All right. Just put that down and take a few notes real quick. So now I want to go ahead and just take a little look inside your nose and inside your mouth. So just going to grab my otoscope. Going to just twist that together. Here we are. Make sure our light's on. There we are. And I'm not going to pop on a speculum just yet. I'm going to have you tip your head back, and I'm going to come somewhat close, but I won't be touching you. And I just want to take a look inside your nasal passages, right? Okay, so go ahead and tip your head back then. ahead and put your head down real quick. So I'm going to have you open your mouth, right? And I want you to say ah for me. Alright. Looks good. Everything looks pink and healthy. The tissues look moist. Right. You can go ahead and put your tongue back into your mouth, okay? Alright. So I'm just going to grab our speculum here. There we are. Feisty things want to stay in their container. Here we are. And I'm going to be taking a look inside of your ears after I do just a quick little inspection. Here we are. So I'm just going to be palpating and inspecting the ears, if that's okay. Alright, so let's start right here and just take a little look at the ear. And just taking a look at the preauricular area. I'm going to pull your ear back and take a look at the postauricular area. Alright. And just have a little feel of the ear. I'm not noting any lesions or any irritation or redness or swelling, nothing that would alert me to anything going on. Switch to the other side real quick. And again, taking a look firstly at the preauricular area. And then just pulling the ear back and taking a look at the postauricular area. Right. And just noting that there's no skin changes. There's no signs of any skin issues or abnormalities. Everything's clean and clear. Alright, so I'm going to grab our otoscope and I'm just going to pop the light on there and take a little look inside the ears. So I'm going to be pulling up and back on the top part here of your ear, right? So pulling up and back, and then I'm just going to be inserting the otoscope into the ear canal and having a little look around the ear. So looks like there doesn't seem to be any irritation. I'm not seeing a buildup of cerumen or anything of the sort. The tympanic membrane looks beautiful. And all just looks just nice and clear. I'm going to bring out the otoscope. Put your ear back there, right? I'm going to switch to the other side. And just pull up and back, and then just inserting the otoscope into the ear canal. And again, just looking for any signs of anything abnormal. But this is largely the same story as the other ear. No irritation, no swelling, no redness, no impaction. Tympanic membrane is pearly gray. Right, I'm going to take the otoscope out. Here we are. Well, that looked very fine and dandy. Right, so doesn't seem to be anything wrong from the neck up. So we're going to move on, and firstly I want to just check your pulse real quick, okay? So it doesn't matter which arm we start out with, but I do want to check both of them, alright? Okay, so we'll start right here. I'm just going to put my index and middle finger on your radial pulse here, right by the base of the thumb. Right. Strong, steady pulse. Excellent. Let me go ahead and just switch the other side here. Again, putting my index and middle fingers just at the base of the thumb here. Right. Okay. Very good. Same deal here. I'm just going to check your pulses here at the same time. Just want to note any delays or any abnormalities. Alright. Okay, that sounds normal to me. So next I want to really quick just take your blood pressure. I know it was taken when you came in, but now that you've been relaxed and just been hanging out for a little bit, I'd like to just do that once more. So I'm going to grab the sphygmomanometer. Do you have any arm that you'd prefer your blood pressure taken on? Okay, so I'm just going to open up our cuff here. I'm going to wrap this around your arm. Alright, that's quite firm. Alright, so let me just pop in my stethoscope. And I'm going to just put my stethoscope here right on the crook of your elbow here. And I've got my pressure gauge here, and I'm just going to fill the cup. Okay. Alright, let's go ahead and try that again. Alright. Sounded excellent. Your blood pressure is just fine, well within normal limits. So I'm just going to take the cuff off of your arm. And just place that to the side here. Now, real quick, I'm just going to take some notes in regards to what we've been doing so far. Just catch up. And then I think we will take a little listen to your heart. Here we are. So, pop the stethoscope back on. Firstly, I'm going to take a listen to your heart, and then I'm going to take a listen to your lungs, alright? Okay. So, for listening to your heart, I will have you just breathe normally, alright? I'm just going to press my stethoscope here to your chest, and just listen as you breathe. Listen as you breathe. Just breathe normally. to take a listen to your lungs now. And when prompted, I just want you to take a deep breath for me, alright? Okay, deep breath in and out. 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 Alright, that sounded excellent. So I'm just going to be taking a listen on your back, alright? So I'm going to get up and I'm going to move over to listen to your back better, alright? Just going to take that out real quick. Makes it a little easier to move, alright? So, just going to be pressing the stethoscope here on your back, and just want you to take a deep breath in for me and out. Deep breath in 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 and out. Last one. Deep breath in and out. Alrighty. Lungs sound clear, heart sounds fine, nice and strong. So far there's not any glaringly obvious things that might be contributing to your just general fatigue. But we have just a few more things to do, and we will exhaust all of our routes before we close that case, of course. So now I want to have a little listen to your abdomen. I'm going to have you lay back for me, and just going to be taking a little listen to your tummy. I just want you to just breathe normally for me. Mm-hmm. All right. Mm-hmm. And now I'm just going to be feeling around your abdomen. So please let me know if there's any pain or tenderness at all, right? Right? So I'm just going to be pressing down. Mm-hmm. Right. Okay, I'm going to do that again, but this time with a much more firm pressure, alright? Please let me know if there's any pain or discomfort. Good. Good. Right, still doing okay? Very good. Alright, so lastly, I just want to check your pedal pulses and just have a little look at your legs and feet, okay? So you can go ahead and sit up. I'm just going to sit back, and firstly I'm going to grab onto your ankles and just feel for a couple pulses in your feet. Okay, very good. And the legs themselves. Good, there's not any lesions, there's no signs of any swelling. Okay, I'm just going to press on your ankles here. Your feet are nice and warm. Mind if I see your fingers real quick? I just want to check the capillary refill. Alright, so that about wraps up our general examination. So it seems that we have not found a cause just right off the bat. However, this is just the beginning, so I think we can run a couple of tests. Most notably is going to be blood work, so we can check if there's any deficiencies, we can check how your organs are functioning, your thyroid levels, all that good stuff, right? So let me just jot down some notes. So I think for certain with what you've told me, that's something that might have a good possibility of helping, of course, is some more sleep, right? I know sometimes that seems like the easiest solution, but the hardest one to achieve, right? Yeah, so a couple of things that might help in regards to the tiredness is to firstly wake up at the same time every day. I wouldn't try to overcompensate for losing sleep and just trying to get as much sleep as you can. You really want to give your body a chance to have its circadian rhythm, its natural sleeping pattern, just establish a more rigid schedule, and trying not to go to bed so late at night might help a little bit too, right? But if you do find that you are having a tough time just trying to fall asleep, you're really just tossing and turning, it may be a good idea to physically get out of bed and go do something for a little bit, whether it's read a book, whether it's go watch TV for a little bit. Playing on your phone might not be a good idea. However, a lot of phones have a blue light filter nowadays, which makes your screen look very orangey or very yellowish. That can sometimes help. A lot of times that blue light is what messes up your body's sleep schedule. So just finding something to do for a little bit and then coming back, sometimes it's just the little reset you need. It doesn't necessarily work all the time. These are just suggestions, right? Another thing you may want to think about, especially this time of year, as the snow falls, it might be a good idea to look into a multivitamin. More specifically, you want to look for vitamin D and vitamin B12. Those two are most notable for having an impact on any sort of fatigue or brain fogginess that one might have. That might help a little bit, seeing as vitamin D is a little bit in short supply, right? So again, not necessarily a fix-all, might help a little bit. And I think getting some exercise would certainly help. Meditation might help. But if all else fails, we can certainly discuss some medication to help with that sleeping issue, right? There's a lot of different options we could try. A lot of them have next to no side effects for the general population, right? So I want you to keep me posted regarding this issue, right? And as soon as we get all of our tests back, I'll give you a little call and we'll discuss what's going on, where we should go next. If you have any new or worsening symptoms, please give us a call. All right? So we really want to make sure that you are feeling the best that you can. We want to do everything in our power to make sure that you're well. So it doesn't feel very good when I have people who aren't feeling good in my office. I want them to feel much better, right? So, you have any questions, any concerns for me? Okay. Oh, the eye strain, you're right. In regard to the eye strain, it might be a little bit due to your screen time. And also, I found that sometimes just during certain days, like cloudy days, for instance, your eyes just don't want to work right. Just the changing light levels and all the different sorts of light that we look at. It's not necessarily scientific, but I've noticed anecdotally that that's been a factor. But the screen time is a big factor in eye strain. So if maybe for every half hour to an hour that you're looking at your screen, I just want you to take a look off of that. Maybe look at something across the room for 20 seconds, look at something close to you for 20 seconds. Just kind of move back and forth and exercise your eyes a little bit. That may help with some of that strain. And all in all, just reducing screen time will help quite a bit. All right? I'm sorry we couldn't cure this immediately for you, but we're certainly starting the journey to figure out what's going on and hopefully get you to a better place here quick, right? Okay. Thank you so much for coming in today, and I hope that we will stay in touch regarding this issue, right? So, I hope you have a whale of a day and a good rest of your night. Thank you. Goodbye now. Thank you so much for watching. I really appreciate it. Please like this video if you want to, comment if you'd like to, and subscribe